policy papers and briefs, always working on something, and is working closely with key regional stakeholders, just like the Pan American Health Organization, the Caribbean Public Health Agency, as she seeks to accelerate CARICOM's response to the NCD's epidemic. Last but not least is Maisha Hutton. She has been the executive director of the Healthy Caribbean Coalition, the only regional alliance of over 100, I don't know how she does it, NCD-focused civil society organizations since 2012. Now, prior to joining the HCC, Maisha worked in HIV, AIDS, and STI prevention for over a decade. Yes, she clearly started at age 9. At the HCC, Maisha is responsible for the daily operations, providing strategic oversight and management across all areas. Maisha also serves as a member of the NCD Child Governing Council. So as you can see, we have a fantastic panel lined up for you. Before we go into the panelists and their discussion, we want to set the tone for you about this project and these courses. So I'm going to invite Dr. Heather Herewith to give us just an overview of the joint postgraduate programs in health policy and health systems. Over to you, Dr. Herewith.
Sure, thanks so much, Lisa, and welcome to our attendees to this afternoon's webinar. So in brief, just to give you an overview of these programs, which were launched on April 19th, 2022. These programs in health policy and health systems, both a certificate and a diploma, are really designed to build human resource capacity within the Caribbean in areas that we think are very important to have highly trained personnel so that we can advance towards health system strengthening and also universal health within our region. And I think we can all agree, if we reflect over the past 2+ years, that the current COVID-19 pandemic has really challenged health systems, locally, regionally, and globally. But one of the things that we thought was important was to see what sort of opportunities could be leveraged, and really the opportunity to strengthen virtual platforms and offer online courses was something that became very relevant and was identified as an important need. And we thought that we could, join forces. So I'm happy to have this collaborative with, PAHO, that we could allow greater access by a large number of participants from the region and beyond by looking at a more virtual-based delivery for our programs. The programs are relevant for persons from a number of areas. So we want to target persons who work in ministries of health and other entities of the public health sector, but also members of the private sector, civil society organizations, persons who have interest in law, in health advocacy, and any other non-professional who's interested in public health, which could be simply defined as the collective actions of us as a society to help improve health, promote health, and to prevent disease. Now, if you register with our program, I can give you a bit of a summary from some things that you would be studying when you join. But I just want to set the stage by saying that, the whole idea behind these programs is to really have a critical thinking approach to explore strategies for effective healthcare leadership and policy making. Because I think one of the challenges that arose during the COVID-19 pandemic was to identify that there were some gaps in the human resource capacity. So this program is really meant to bridge some of those gaps. And we want to have this critical approach where we can think about how to advance healthcare towards universal health and how we can really, make this something that becomes like a thread through all of the public health practices across our region and to strengthen us as a region. Importantly, the programs will be offered via a combination of online and blended modalities, which would increase the reach across the region. So persons can join us from, any point in the Caribbean, because the programs will be offered in a way where you can join online, and you'll be taught by persons who have adequate training in online pedagogy as well. So, the programs have been developed in this manner. There'll be a number of topics to be covered that include core public health competencies, and there's an emphasis on things such as leadership and governance, but also management of human, financial, and other health system resources and health technologies. The two programs, as I noted, are the certificate. So the graduate certificate consists of 12 credits, so there'll be 4 courses which are taken, and the graduate diploma consists of 6 courses and a 1-month internship at PAHO. Now, importantly, persons who register for the certificate can choose to take the additional courses, and they can actually ladder up to the graduate diploma program. And the programs will be offered either full-time over 1 year, or if you prefer to study more flexibly, you can study for part-time over 2 years. So a number of courses will be covered, such as health economics, medicines and other technologies, public health leadership, and managing human resources for health. So I hope that this has been enough to whet your appetite and to, stimulate some interest in our program. And I'm happy to answer any queries that you may have, and I will just be sharing some contact information in the chat box. So you can check our webpage, which will have all the information, including how to finance this program. It is a self-funded program, and my email is also being shared in the chat. I'd be happy to follow up with any queries, but we do invite persons from across the spectrum of health, as I said, whether you're in the Ministry of Health or whether you're someone who's just interested in making the public health system function better. This is a course for you, and I really look forward to having you join us here at KFIL for this UWI PAHO joint program in health policy and health systems. So thanks, Lisa.
Thank you so much, Dr. Herwood. It sounds like it has a lot of emphasis on flexibility. That is definitely something that's needed for persons who are working, especially persons working in the health sector. Flexibility is definitely the name of the game. Looking forward to having more conversation on this. I used to say I wanted to work in health policy, so I never know. Maybe one day I'll sign up for the course. We'll see. Let's talk now with Dr. Puertas, because Dr. Puertas came on board to PAHO Caribbean. He heard about the conversations that we had begun with the University of the West Indies, and he was like the perfect person to join the PAHO Caribbean office to bring this all home. So Dr. Puertas, do tell us about your perspectives on this collaboration.
Thank you very much, Lisa, and my greetings to everyone, to my colleagues, panelists, and to those who are joining us live in this very interesting panel. The process, as my colleague Lisa Bailey mentioned, was quite a challenging one that took time and effort to identify health policy and health systems. Why are those two elements the core of a new diploma and certificate, and especially this collaboration between PAHO and the University of West Indies? I think health policy, as probably you know, is relevant, even more relevant now after the pandemic, because it helps establish guidelines that benefit healthcare organizations, healthcare systems, and the population health, which is the most important component. The health implications of policy decisions need to be considered not only to prevent harm, but to promote health. And when we were in this discussion with UWI, PAHO kept always in mind that we have this strategy that we call PAHO Health, Health in All Policies in the Americas, which is an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies, and avoids harmful health impacts in order to improve population health and health equity. So when we were talking about what was the best way to have a accredited academic program that is going to be very useful for the professionals, healthcare professionals and health professionals in the Caribbean, and also to build the health systems, then we came out to the importance of health policy development, and of course within this framework of health systems. And then it became easier, the discussion, because after we identified the core elements, then we just started talking about what should be included as part of the program, and that Dr. Hayward already mentioned some of the modules and courses that the diploma and certificate will contain. So some of you probably saw the video that started running while you were waiting for the panelists to appear. And that video shows one experience that also was very important, because it shows a process, and a process in which you have building evidence as the first step. And that first step was understanding what was happening in terms of the impact of the pandemic in the human resources for health in the Caribbean. And as you all know, probably in 2020, 2021, we were wondering what was happening in terms of the health workforce that already had challenges even before the pandemic. So now we started identifying some very interesting measures taken by the countries in the Caribbean. So the first thing to do was to start systematizing those experiences. And we worked with information from 12 countries originally in 2020. And then we decided that a case study would go even deeper into the analysis. And we chose the case studies in Belize, Jamaica, and Grenada. And that was building evidence. And from that evidence, we started a process of advocacy. And in that advocacy, we had our partners from CARICOM, from WHO, and of course, PAHO involved at all levels in the Caribbean to bring this information of this data that we obtained from different countries and the challenges that countries were experiencing to respond to the pandemic. So evidence, building evidence, advocacy, and advocacy took us to policy development. And the example is the COSOT 41st, in which policy brief prepared by the HRH Action Task Force and with the support of PAHO and CARICOM was approved and it became a mandate. So we completed the third stage. And from policy development, we moved into implementation and eventually it will be evaluation. So that really shows how important is policy development. And here we have a lot of academics and probably among the audience also. And you know that at the university level, this term publish or perish. But I think that's kind of harsh words because it doesn't matter if you publish and the information stays in a desk or doesn't reach the proper decision makers and it becomes policy. And that is what makes the difference. So I invite those of you who are interested in going deeper into policy development, health policy development, even if you are not health professionals, because you heard the approach of health in all policies, which means that it's building policies across sectors, not just related to the health sector itself. But remember, is to avoid harmful health impacts and to improve and promote health. And I invite you to consider a diploma or a certificate because this is something that we really need in the Caribbean and something that the pandemic showed us to be essential and fundamental to improve population health. So I am really happy and excited to see the first cohort of the diploma and certificate, hopefully next September. PAHO is supporting and will continue providing its technical support to not only this stage in the development of the diploma and certificate itself. So I really take advantage to thank my colleagues from UWI, from CARICOM, and to all of those who have been part of this project that we started and we continue. And we will see you in September with the first cohort. So thank you very much, and back to you, Lisa.
Thank you so much, Benjamin. You sold me, sign me up. I'm ready to start the course. What's interesting is that some keywords jumped out of me. And when I first started on my journey on public health, and Dr. St. John could attest to this, I wanted things to happen now, but it's a process. It's a multi-sectoral approach, and these things take time. And we're going to talk about some of those challenges and opportunities that exist in this multi-stakeholder process-oriented approach. Can't be hot and sweaty implementing policy, and this I am learning for sure. So let's go to our other panelists now, and please remember you can put your questions in the Q&A. For those of you who are watching us on YouTube, feel free to put your questions in the chat as well, and they will be sent over to us in the panelists, and we will be sure to answer your questions. I want to thank our media persons for joining today as well, so thank you for joining. So let's go now to panelist Dr. Joyce St. John. She's going to give her perspective coming from the Caribbean Public Health Agency. Welcome, Dr. St. John.
Thank you. I am about to share my screen. But I also want to say that some people are reporting they're getting problems logging on to YouTube or the Zoom link that they had. Can you see the presentation on the screen? Can you see it in slideshow? Okay, and remember to stop me at times. So what I'm going to give you is an idea of pathways to policy, because it does happen that policy occurs in the Caribbean, and some far-reaching policy that also affects global trends. So I start off first with this very famous picture of the group of wise heads of government of the CARICOM who came up with the 2007 Declaration of Port of Spain, where they made a commitment to action for NCD prevention and control. And it was such a visionary document that it's still relevant today. And it also triggered a series of global actions which culminated in the UN high-level meeting on NCDs. So what are the determinants of a healthy Caribbean? So if we're going to do any policy, we need to know what it takes to make the Caribbean healthy. Well, these are some serious concerns that we have. We have issues with climate change. The fact that for most of the Caribbean, tourism and travel are the thing for economic stability, but we've seen how that can be affected by one virus or variants of that virus in the pandemic that we're still in, COVID-19. There's also the effect of the globalization of determinants of health, the kinds of foods that are imported. And of course, in this small part of the world, the burden of chronic disease and risk factors is off the charts, record setting in the region of the Americas. So there have been several pathways to policy that are in the domain of the CARICOM, public health, and CARICOM sectoral space. One is a pathway to policy given by the annual Health Research Conference, 66 years this year, where young researchers and old researchers and researchers from around the world come together to learn about new research about the Caribbean and conducted in the Caribbean. And that is juxtapositioned with the attendance of chief medical officers who take this information back to the policy makers. Then, of course, there's the fact that there is CARICOM, the political construct and its convening power, which allows many sectors to come together and deliberate on matters. And there is also the organs of CARICOM, the different bodies like the COSOD and the COTED, which make policy decisions at the regional level. Caribbean cooperation in health is a compact for regional health development, which goes along with national improvements. And this Caribbean cooperation in health is a great foundation for regional action. And then there is the fact that there are chief medical officers that can meet and work together to look at the ways in which policy can be developed and recommended to the policymakers. And of course, there's the role of entities like CARFA, PAHO, regional surveillance. So we know the trends of disease. We know what we can expect. We know how to deal with it. So what are some of these pathways? I spoke about the conference, and these are pictures from the conference. The last conference is actually virtual because of COVID. And here is where a lot of the new information comes to the region. The CARICOM convening power, very well demonstrated during the pandemic. You saw all of the heads coming together and effecting change, which was important to protect persons from illness during the COVID-19 pandemic. Oh dear, where's it going back? Then, of course, there is the whole issue of the Caribbean cooperation in health. And here we see iterations. The recent iteration, fourth iteration, is looking at regional public goods, so that the focus is now on what are some of the tangible outcomes of the iteration. The CMOs, this is a picture of the recent face-to-face meeting in April, where 18 CMOs came together, 3 joined us virtually. And regional surveillance. And we're working now with the integrated regional surveillance strategy, so that we use all of the data sets and see how they link and affect what is happening in the region. Coming out of surveillance, we also have the statutory responsibility of an annual State of Public Health report. And here is one that was done recently on climate change and health, so that the surveillance of climate change and health and its effects on the region can guide the development of policy. And health in all policies includes the issue of health in the policies of the tourism sector, that very important sector. And there's a tourism and health program in CARFA. And I end with a discussion about what the heads of government did. In 2007, it was a focus on non-communicable diseases. In this year, it was focused on communicable diseases, and policies were all sectoral. Is that I have 1 minute or that I have to stop? Okay, well, thank you so much for showing you the pathways to policy. And I am hoping that the university course will look at some of the policy that has occurred in the Caribbean.
Thank you so much, Dr. St. John. I'm sure it will. Thank you for sharing the pathways to policy, the different organs and the parts of CARICOM, the CMOs, all of the different mechanisms that work to ensure that policy is discussed and then implemented at a regional level. So thank you very much. I'm sure that will weigh in the conversation we will have soon. Let's go now to Ms. Nicole Foster as she brings the legal approach to healthy public policy. Go ahead, Nicole.
Thanks, Lisa. Let me just quickly share my screen. Of course, I have the document at the end, but don't worry, I will just very quickly go to the beginning. Okay, so my role today in the panel is, so I'm the odd man out, the one with no health background whatsoever. I'm the lawyer. And you might wonder, what does law have to do with it anyway? Oh, sorry. Let me just make it.
Remember to go to full screen.
Right, full screen. You might wonder, what does law have to do with it anyway? And really, if nothing else, I want you to go away appreciating that law is fundamental to making good health policy. And why is that? Well, the importance of law stems from its role in terms of its ability to regulate the environment. And Dr. St. John would have just given you just a taster of all the different areas and spaces which are impacted by public health. And thus, law is then a very important tool in this space, insofar as it can modify, as Lieberman points out, the structural determinants of social inequalities, the causes of the causes, both domestically and internationally. And then we also have law as a constraint. So as we try to regulate and put in place public health policies, we also have to be conscious of the parameters within which we have to operate. And so we can see, as Lieberman also points out, that law can exacerbate social inequalities. So protections on freedom of expression may run afoul of effort by public health persons to regulate marketing, for example, within our societies. And certainly many of us recall the debates, the ferocious debates that took place in the context of COVID yes, in terms of restrictions on freedom of movement and how you strike those balances. And law is critical to those discussions. And just to sort of reinforce that even further, this picture here gives you a sense of how interconnected law is to the public health space. So whether it is constitutional law and the many diverse areas, let me say, so there's no one area of law that's important, it's all important. And so whether it is, we're talking about constitutional law in the context of constraints and or rights in the context of freedom of expression, the right to health, etc., or administrative law, as we're looking at due process issues and access to information and transparency and all those things, intellectual property, trade, you name it, they're all important. And really, it was with this recognition that the Cave Hill Law faculty last year, almost a year now, July 7th would be a year, we set up a law and health research unit within the Cave Hill Law faculty, very much to act as a tool and as conduit to help people better appreciate this connection. Because I must tell you, I have numerous discussions with persons about what does law have to do with it, even after a year of the law and health research unit being around, and sometimes even persons on campus themselves don't get it, right? So, now, what are some of the challenges that we have in terms of policy making and that in the public health space and specifically that connection with law? Well, the first challenge that we have is the lack of understanding of the link. As I said, even within the university space, it is sometimes difficult for persons to understand. For the less within government or the general public, it is not an area that traditionally people have understood there's a connection for. However, if you think about the best buys, for example, for NCDs, you would realize that practically all of them rely on law for implementation. And that alone speaks to the power of law in this space. Then you have also the problem of our government processes, right? So government is, of course, the principal actor in this public health space. And to the extent that we have compartmentalized, fragmented processes, that undermines the ability for persons to understand and include law within those spaces. And that contrasts sharply and powerfully with the Chilean experience, for example, in terms of front-to-part warning labels, where we saw how by including law from the very beginning, so this spoke to everybody, not even just the lawyers, but I'm speaking about law, by including everybody in this space, it means from the beginning, it meant when they got pushed back in WTO, in FAO, in Codex Alimentarius, they weren't frightened, they weren't cowed, they weren't frozen, because they understood that they were in the right, that the law was on their side. Then we also have the challenge of limited capacity in the areas linked to the, whether it be international trade law, international investment law, international human rights. And that tends to then translate into potential regulatory chill. So you have in the public health policy space, maybe our governments not being as ambitious as they should be because they think, oh my goodness, I can't do this. WTO doesn't allow me to do this. And industry exploits that, right? So they exploit the fact that they know there's not that necessarily that understanding or expertise. And so we saw, for example, by contrast, how Barbados, when we were looking at trips on public health in 2001, we were able, the drug people in the Ministry of Health were able to utilize the knowledge of the mission in Geneva in terms of what was happening with trips and public health to factor into their discussion with the drug agencies, with the pharmaceutical companies, etc. To say, no, an intellectual property right is based only on the territory in question. So we don't have to recognize a patent that you have in the US, which is what the drug companies would have been trying to convince them was necessary. Then we do have limited or no involvement of legal professionals from the beginning, and that's important. We tend to rely on lawyers at the end when we have a problem, right? So we'll rely on the Chief Parliamentary Counsel's office to do the drafting, right? And then that's their first intro into that, the lawyer's first intro into the space. And then we rely on the AG's chambers if anybody brings a case. And that's fundamentally flawed. We really need to have legal professionals in from the very beginning. And we saw, for example, how Australia was able to very successfully defend its plain packaging legislation in the context of the WTO and other investment challenges. And key to that, as the Australians themselves who were involved with it testify, is that they were involved from the day one. From day one, they were part of the conversation about how do we put this together. They were sitting side by side with health. And therefore, when the agency, when the drug companies, etc., came, the tobacco companies came to say, oh, we're going to carry you to the WTO, and oh, we're going to, they said, bring it on, because they were confident. I mean, you can't be 100% sure what will happen in the case, but they were quite confident because they know they'd done their homework legally. And then lastly, we have the issue of lack of understanding of the legislative process and its various entry points. That can be quite powerful in terms of points at which you can come in to influence the process, to advocate, etc. And certainly, we don't necessarily fully understand, the public generally doesn't understand those legal processes quite as well as one would like, to allow them to be, this public health policy space to be as effective as possible. But what then are our opportunities? How can we tip the balance so that we have strong, effective health policies? And then, so we have some tools, right? So we have the UWI. We have the UWI with its regional and international expertise in both law and health. As I said, we've set up within the law faculty at Cave Hill a law and health research unit that is very much oriented in terms of providing the support, training, and analysis. I just note here, for example, the Law and Health Research Unit and the George Allen Chronic Disease Research Center, for example, recently participated and put in submissions in the WHO Pandemic Treaty public hearings. So you see how we can leverage the power of UWI and the expertise of UWI to get into these spaces in terms of creating policy. Then there's, of course, the recently created last year as well, Caribbean Public Health Law Forum, first international regional network linking public health and legal professionals. That's so important for us. So we now have opportunities to have conversations with each other, to build networks, to build relationships, to leverage our respective expertise in ways that wasn't possible previously. Then we also have a number of important academic and non-academic partners. So the PAHO, we have O'Neill Institute for National and Global Health Law, and others as well, who we're able to work with to really better understand how we can get more synergies between law and health, how we can better realize the health in all policies goal. And then finally, and leading nicely into Maisha's piece, is civil society. So civil society has been a powerful and important tool. I often say to Maisha, I'm convinced that change will come from the bottom, not from the top. And in that regard, civil society is a sine qua non of this process. And we have seen, certainly in Barbados as well in Jamaica, how civil society, HCC, the Heart and Stroke Foundation Barbados Inc., and the Barbados Childhood Obesity Prevention Coalition has been able to powerfully organize themselves and leverage the skill sets within those coalitions to really push government in terms of policy making, but also influence the inputs to those policies in a way that allows us to have some level of confidence that they're going to be impactful, effective public health policies. And that's it.
Thank you so much, Nicole. I nodded my head so much, I think I made myself a little bit giddy, but agreed. And I feel your pain as a communications person about being brought in at the end. You know, you need to be brought in at the beginning. So much is becoming clearer as we talk, because I'm thinking, how can one person understand all of these areas? And it's impossible for one person to have all these skills. But I think what is coming out of this is that we need people with different skills to know how to assist in creating healthy public policy. So that's what I'm learning already from this afternoon. You did segue very nicely into my friend Maisha Hutton, who is working with the Healthy Caribbean Coalition. She's the executive director. So Maisha, give us your perspective coming from the CSO side. Over to you.
Thank you, Lisa. Let me just start my timer so that I am on time. Providing civil society perspectives here on the need for health policy in the Caribbean. And this is an image from a recent campaign that we launched towards the end of last year, calling for healthy food policies, in particular for children. So this image to the right is our transformative new NCD agenda. We launched it in 2020, and it's really at the heart of it is around people power to drive NCD policy in the region. And why NCD policy? Because we know when we implement policies, the end result is population-wide impact. And HCC's policy priorities really reflect the NCD risk factors in the NCDs. So we do work across unhealthy diets, tobacco, alcohol, in particular on the NCDs, cervical cancer and diabetes. There are a couple of cross-cutting areas that we focus on as well, and those are accountability. So we know that a number of our policymakers have made commitments, they're in existing mandates, and how do we play that watchdog role and hold them accountable? The second one is this multi-sectoral approach, and Lisa was just chatting about that, and that's enshrined in our mandate. So how do we support multi-sectorality, pulling on diverse partners? All the while, though, in the third area is managing conflict of interest and industry interference. When we have all of these diverse partners coming together, we need to ensure that we safeguard the policy-making space from vested interests. And so what are the strategies that we adopt? I mean, really the end point we want here is we want to create an environment that moves us from policy inertia or policy rhetoric to policy action. That's our priority. And we do this by building high-level support for the policies we want and public support. And we do this also by countering any sort of any negative influences which may be aimed at derailing the policies that we want. And so we do this by establishing partnerships, creating coalitions, public health coalitions that are strong and diverse, leveraging legal expertise, leveraging the expertise of CARFA and PAHO and other key partners across the region. We collate evidence, working with UWI and other academic institutions. And then we translate that into information delivery tools, whether they're campaigns, whether they were developing tools to build capacity. And we've worked with Nicole on a number of different tools. Policy briefs, Dr. Puertas mentioned the importance of those at the outset. And we do this all to move along the advocacy continuum from public awareness to actual policy implementation. I'm going to share a few examples of the policies that we have worked, or the policy areas that we work in. This one is tobacco. You see tobacco images on the right. This is around the CARICOM commitment to 100% smoke-free Caribbean by 2022. And working in partnership with PAHO and Nicole's unit, the Law and Health Research Unit, we developed these 6 resources, policy briefs to build the case for this regulation outside of health, very importantly. And we heard Dr. Puertas talk about health and all policies and reinforced again by the other presenters. And then we also we have these case studies, and the case studies really help to allow governments seeking to implement this type of legislation to understand the legislative process. And for advocates, it helps us to understand the legislative process, which is very important in our advocacy. Shifting to alcohol advocacy, we have an annual day we've held every year since 2016 in partnership with CARFA and PAHO. And this is really around building awareness around the need to address this risk factor, which is often ignored, but also importantly to build support for comprehensive alcohol prevention policy. Healthy food policy is a big area that we work in, and these are some campaigns that we've implemented over the course of the past few years. And most importantly is our front of package warning labeling campaign. We mobilized over 350 public health professionals in support of the regional standard for octagonal high and front of package warning labeling. You see an image there from the HFJ Heart Foundation of Jamaica trying to counter and putting squarely in the media countering industry interference. And then to the right is a tool we've developed, model policy and legislation for countries seeking to implement healthy school policies. So that's a taste of some of the healthy policy work that we do. Conflict of interest and industry interference, especially in the NCD space, NCD policymaking space, where we're dealing with commercial determinants of health and unhealthy commodities. This is one of the single greatest barriers to policy implementation. So we've just worked on this campaign this year. It's being aired right now, and it's around trying to kind of pique the public dialogue, policymaker dialogue, and interest and awareness in this idea of conflict of interest. We've had some policy wins, due in part to civil society advocacy. On the left, Barbados just doubled their SSB tax. And we also have had quite a bit of momentum around school policies over the past few years. And this is an example from Grenada. So wrapping up now, what have been, kind of the major challenges? COVID-19 has obviously been a distraction. It's created competing political priorities. There's also waning political appetite, weak regulatory capacity, and Nicole talked about that, and also weak advocacy capacity, weak civic engagement, very much related to this idea of people power, conflict of interest, as I mentioned, and broadly speaking, poor public health governance. And then these are all exacerbated by our small communities. And the opportunities, there is increasing policy momentum. There's a growing investment in advocates and civil society groups and other key groups. So we're building that capacity to advocate. We are mobilizing key groups such as people living with NCDs and young people. We're expanding these really powerful coalitions of influence, and we're seeing emerging champions, and we're creating the space for, very importantly, political champions as well, strengthening partnerships. We're increasing the awareness around commercial determinants of health that's happening nationally, regionally, and globally. And related to that, of course, is conflict of interest and industry interference. And we're also seeing a global and regional emergence of framing of this issue as a rights and equity issue. And hopefully we'll start to see the public start to see it as a right to have these NCD policies. And then, of course, there are positive elements of COVID. It's created this knowledge that NCDs and obesity really need to be prevented not only as a health issue, but as a security issue. It's highlighted the issue of food and nutrition and security. And then importantly, there are integrated agendas and intersectionality that we need to really draw on in order to increase policy. Let me wrap up real quick. Increase policy support, especially within our small resource limited settings. So I think, yep, that's it. Thanks very much.
Good job. Thank you very much, Maisha. I think I'm going to start with you, the questions, because it's in my head right now. I think sometimes people feel as though the role of HCC and other CSOs is just to do the campaign. But I think it's important for you to say that your work in policy is behind closed doors, attending meetings, giving the CSO's position in those meetings with technocrats as well, advising governments. And so it's not just coming up with campaigns, that's the end result, correct?
That's correct. And I think it's such a good point you've mentioned, Lisa, because I think before we had the resources to implement these campaigns, because these campaigns are quite recent, a lot of our work was just grinding behind the scenes, working with our CSOs to build their capacity to advocate, creating checklists, sessions to build capacity around and learning the evidence so that we could articulate the evidence, meeting with high-level policymakers, identifying champions and people who could exercise influence at different levels in different spaces. So it really is a lot of moving parts and a lot of partners coming together. It's not just HCC, it's HCC and the law faculty and PAHO and CARFA and civil society organizations on the ground, and everyone trying to pull on partners and leverage their respective strengths to move us closer to policy implementation, to create that environment in which a political actor feels like, you know what, I can move forward with implementing this policy.
Agreed. Now, I do have someone who wants to ask a question, actually vocalize a question. I don't know if that's going to be allowed, but he is a journalist taking notes, so I feel his pain and I understand he doesn't want to stop taking his notes to type a question. So if Mr. Hope can be allowed to ask his question, as we sort that out, I do see there's a question that went to Ms. Foster. You answered it, but I wonder if you would like to also say that for those who may not have seen your answer in the chat. I see Hallam has been given the right, so maybe Hallam, you can go first, and then Nicole can address the comment in the chat. So Hallam, over to you.
All right, I believe I have 4 questions, but I understand you only give me one check question, right? So eventually 4 I'm going to choose.
We'll see how it goes. Go ahead, choose 2.
All right. Well, first of all, let's explain. I heard about a certificate and a diploma, and I heard about one cohort. So could you explain, is it one program with either certificate or diploma? Is it 2 programs? Would you kindly explain that? Thanks.
Sure. Heather, would you like to take that one?
Sure, Lisa. Thanks for your question, Helen. I actually tried to type it in the chat. So essentially, there are 2 programs. The certificate program is a 12-credit program. So persons will take 4 courses, each for 3 credits, and this can be done, as I said, over 1 year as a full-time student or part-time over 2 years. The diploma program now consists of 6 taught courses for 18 credits, and then there's a third, let's say a third component, which would be the PAHO internship. So this is done for a month in collaboration with PAHO. So the total number of credits would be 21 credits. So they're distinct. But what I was saying earlier is that persons who start the certificate could actually take the additional courses and then ladder up to the diploma program should they wish to. And both can be taken either full-time over 1 year or part-time over 2 years.
Right. I was also interested. Yeah, I was also interested in whether Dr. St. John could expand on the issue of climate change so that people might not be fully aware of the interconnection of the 2. And I'll just share my other 2 questions, even if you can't get to them. One has to do with some expansion on the question raised about technology and the role of technology. And I was also wondering whether blockchain technology has made it onto the agenda. And my final question would have been to Nicole, where I wanted to ask her about the issue of privacy and the perception that some people have that they have a right to their own personal records, and whether these issues have come up in terms of legal issues. So that's it, Lisa. Thank you.
Thank you, Helen. Let's go to Nicole first, and maybe you can also tackle the question from Pierre, and then we'll go to Dr. St. John with the climate.
Okay, so very quickly to start with Pierre's question. So just to recap, the question was about whether law can assist specifically with school nutrition policies. And the short answer is yes. We see how law can be used to want to regulate that space. So you use laws, you can use law to ban certain products from being sold, etc., or to set the parameters for those things. But then also too, from a broader international law perspective, you understand that and constitutional law to a certain extent, children have a right to health. That right to health includes not being subjected to predatory marketing of unhealthy food and beverages. And so our governments are failing in their human rights obligation to fulfill and protect children's right to health and other rights, education and all those things, when they fail to regulate these spaces effectively. And so you see how law can be used directly to regulate the space, but also to as a prompt for government to act based on the obligations that it has. Then in terms of the question from Mr. Hope, so questions of privacy are of course important issues. What you have to recognize is, so I thought he was going to go a slightly different point, and I want to just stress that with all rights there are balances, right? So you may have a right, but that right is always in a sense contained a little bit by the public interest. And so that, but specifically in terms of your records, to the best of my knowledge, we're not in that space yet. So, you know, we tend to be a little bit behind the curve in terms of some of these developments. As you know, we're still now, for example, we're now trying to go through processes of digitization and all of these things. And as we do those things, we're having to come to grips with some of these issues, but it's still, to the best of my knowledge, a space where we're very much still learning and grappling and sort of, so to the best of my knowledge, no, there've been no challenges. And you know, sort of, we've been socialized in a way. I mean, some of the younger persons might be a little different coming up, but you know, like the doctor was God, and you know, you didn't think about asking for your records and stuff. So it's only now that people are beginning to get sensitized to those things. So I'm sure it will come in due course, but to the best of my knowledge right now, no, we're not yet in that space. Over.
Thank you so much, Nicole. Going to come to you now, Dr. St. John, the linkages to climate. And there's also a question for you on how our population needs assessed and used to inform policy development process.
So climate change and health was one of my elements in the portfolio that I had in WHO. And climate change has many effects on health. And the things that change climate also affect health. I think of air pollution. And air pollution causes issues with lungs. Everybody could understand that. But at the same time, while it is affecting your lungs, it's affecting the atmosphere. And there's also the effect of the atmosphere, the climate change, on the increase in NCDs, heart disease, etc., etc. So there are intertwined, and they were mentioned in the Paris Agreement on climate change, this whole discussion about climate change and health. And it was said all those years ago that there needs to be a greater focus on the interventions which will reduce the effects of climate change on health. Some of the things that I can just give an example of, sea level rise and the effect on buildings like healthcare institutions that have to be moved. Sea level rise and the intrusion of salt into water. We get a lot of our water from brine that has been changed through the let me say just the brand name ionics process, and then goes into our water. What is the intrusion of salt water into our underground aquifers? Then, of course, there's the fact that climate change speeds up viruses like the dengue virus. So we're having more cycles of dengue infection, and also there are shorter periods between these cycles. All of these things show the link between climate change and negative impacts on health. Now, to go to the question from Mrs. Carter Taylor, thank you for your question. Let me see if I can find it again.
Yes, the question was how our population.
Yeah, I'm reading it. So with the pandemic, what CARFA did was CARFA found the NCD burden in each country and used that as part of the formula that we used for equity in the distribution of funding, vaccines, equipment, the supplies, the reagents to the country. So we were very big on equity in the distribution of all the resources to fight the pandemic. And we used that, that background as the basis of our formula. Population needs are assessed mainly through the information that comes to us from the member states and the trends that we see. Population needs are also assessed by how people are responding on social media. So we get an idea of opinion because everyone knows now if you do not get public opinion, you do not also get an idea of how what you're doing is supporting people. So those are some of the ways in which these have been used to inform policy, the policy of equity of distribution, the policy of how we responded, especially when we were looking at things like vaccine hesitancy. We did social media surveys of the general population. So there's always that constant interaction. The cold figures and also the warm words of yes, I like it, or
Thank you, Dr. St. John. Your audio is breaking up a little bit, so I don't know if you want to turn off the video or come in and go back out. We're kind of wrapping up now, though, so I see all of your questions and your comments. Dr. St. John, Denise Carter-Taylor tells you, thank you very much for answering that question. I don't see any other new questions. There are a couple related to the course, And I see Heather is typing away, but there are a couple questions in terms of understanding, since it is a blended modality, what duration of time will a regional candidate be required to be in Barbados? I don't know if Heather, you want to take that one, and also what are the requirements for this program? I'm happy to see we have interest in the program. This is good.
It's great to see the interest. So just to clarify, because I think, sometimes when the answers would have gone up previously, may have been missed. So the programs are really going to be delivered online. So you don't have to be in Barbados at this point. Ideally, when we can get I will call it the peri-COVID scenario settled, part of the idea though is that the internship would be a face-to-face internship. But the programs are designed so that the courses are primarily online delivery, so persons can join us from across the region, because the whole idea was to, achieve some of the aims for human resource development from, PAHO's human resource strategy, but also part of the UWI strategy about increasing access and making us more agile in the field of delivering educational opportunities. So essentially, this program allows us to achieve some of these objectives and to make us more accessible and available to students across the region. I am going to put in the chat again the web page link. With respect to qualifications, I can broadly summarize to say that, we are actually willing to consider applications from a range of backgrounds. So persons who might be, I saw someone wrote earlier to say that they were a nurse, so people who might have a medical, clinical, nursing, pharmaceutical, any background like that. But we also recognize that there are people who have a role to play. We spoke about health in all sectors. I spoke briefly about the fact that public health is really collective societal action. So people who might be interested in being lobbyists or advocates for health, and Maisha spoke about the importance of being able to be strong advocates. So, if you have any interest in public health, you have a bachelor's degree. Some persons may not have a bachelor's degree, but they may have been working with an NGO for years. So we're willing to actually look at people's years of experience as well, because we think this is an opportunity that, many people can benefit from. So the actual entry requirements are relatively flexible. They're available, as I said, on the webpage. I'll put it in the chat again. But as I said, I'll also put you'll see my email address when you go to the webpage, and I can be happy to answer further questions. So I noticed there was a question about accreditation. So it's actually, that's the one I was taken away to say that one is a little bit more difficult for me to respond to, because it really does depend on the organization that's doing the onboarding for persons. There's some organizations that will be happy with, because persons may already have say a master's degree or even a doctoral degree in some area, and just having a certificate might be sufficient for them to make a career move. Others might be more interested in having a postgraduate diploma. So it really does depend on where you are working in the system. But the thing is that it does give people an opportunity to be more flexible. And even if you do not leave your current organization, though, it helps you to be able to work more effectively and efficiently within the health policy space as well. So, there are a number of things that we will, and I think over time too, we will actually, as we do our traces studies on our graduates, actually then be able to give a better idea of where does this take people with respect to where they started from, or where they, what opportunities are open for them as it goes through. So there's still much information to gather and to look at trends over time.
Very true. Thank you very much, Dr. Herwood. So yes, please take a look at the website. You can get all of your information there. I'm going to give all of our panelists now maybe some last words, some takeaways, any takeaways you would like to leave to the persons who are watching the webinar now or who may watch it later. So let's start with Maisha and then go back up the line. Go ahead, Maisha. Takeaways?
Thanks. Sure. I think I had two quick takeaways. One is that we really need to be mindful of conflict of interest, and we need to develop those tools to help us to counter conflict of interest, to counter industry interference, and to help us to manage and mitigate conflict of interest. And the other point I wanted to make for those who become engaged in the process of the course is to policy coherence. I mean, that's such an important point. And I think Nicole and I always discuss this, that there's so much incoherence between ministries when it comes to policies, and the policies end up fighting against each other. So that's something, those are my two takeaways.
Thank you, Maisha. Nicole?
Thanks, Lisa. So my two takeaways are, of course, law matters. Law is relevant in the context of public health. It is very, very key in that space. And in that regard, it's important to include lawyers from the beginning, from the very beginning of the process of creating policy, and not wait until you have a problem to have the lawyer come to try to solve it. And also to that, law allows for a lot in the context of public health. So people tend to think that public health and law are at odds. They actually aren't. There's a lot of space there for law to be a tool rather than a constraint. And they need to bear that in mind.
Thank you, Nicole. Agreed. If you're like me, you want a law for everything, but that doesn't work either. Dr. St. John, over to you. Takeaways?
So there's a lot of really exciting policy that has been developed in the Caribbean space. There needs to be a walk through the CARICOM process. It's very powerful. It allows the linkage between a national issue and a regional policy. And I also think it's going to be really important in the degree course to have an intersectoral forum where there is a discussion one-on-one with the students about some actual processes, because a lot of what the Caribbean does seems mysterious because we don't document all the steps. But if they can get a chance to have that one-on-one and those questions, it will make everything clear.
Thank you, Dr. St. John. And that leads nicely to Dr. Puertas, who loves to make sure the evidence is documented, right, Dr. Puertas?
That's true. So, but my first takeaway has to do with the impact. As a young physician, when I was doing the surgery, I was impacting the life of a person and their family, relatives, friends, and that was great. Then I realized that there were other areas like prevention or health promotion in which the impact was higher, and that I like that even more. But when I reached the point to work with health policy development, I realized the strong and powerful impact, not just at the personal, individual, family, or community level, but at the nation level could have. That really made me consider this as such an important area to cover. So that would be my first takeaway: the impact of developing health policy. And the second one has to do with capacity building, my area, and the importance of being able to offer a certificate and a diploma in health policy, but not just health policy, but related to health systems. So we close the cycle. And that's something that, as my colleagues, as Dr. Herwood mentioned, is going to be very flexible. So because we want as many Caribbean professionals or people who are interested in health policy development can join. So that's my last takeaway. Go for it. Learn in a wonderful a year or 2 years program. Meet people that you're going to really share experiences, live experiences, real experiences, and also share yours, because I'm sure that many of you will come with enough experiences to share. Those would be my 2 takeaways. Thank you very much.
Well, I have to say that you and Dr. Herwood should be salespersons, because you definitely sold this course today. I did not come in thinking I wanted to join the course, but perhaps I do feel like I want to join the course now. I hope that you too were inspired to take a look at the course, consider it, or share it with someone who you think could be an asset to health policy development or health system strengthening in the region. They go hand in hand. And you know what I also learned? It takes all types to make policy changes, and it takes time, but we all need to put our hands to the wheel so that we can have positive change. So I want to thank all of our panelists for joining us this evening. To all of you for joining us live and for asking your questions. Please go onto the website, learn more about the courses, and also help us to make sure we improve healthy public policies here in the Caribbean region. Thanks so much for joining. Have a wonderful evening. Bye for now.
Bye.
we to stay or are we to go? No, I don't know if we're talking after.
Great job,
I think
guys.
everybody else is everybody's.
Yes.
They're just trying to lock the meeting so nobody else can get in.
Okay.
This needs a part 2.
I know.
And there was
Just
an
making sure we
issue
were not
with
live anymore.
there was an issue with
Yes,
links
I had
that
an
we
issue with you.
had. So not everybody who wanted to join could join. So we need to do a
However,
part 2.
Great job,
Because
guys.
what everybody else is everybody's.
Yes.
They're just trying to lock the meeting so nobody else can get in.
I think we're still.
Okay.
this needs a part 2.